And so just like cervical cancer screening, treatment, and prevention project planning. And the main purpose of this project was to establish the planning for like an extensive cervical cancer prevention program that focused on the indigenous and rural communities in the Chimborazo province. So number one, why was this project important to take on? Cervical cancer is a highly preventable disease, yet unfortunately, it remains a significant global health issue. It's like the fourth most commonly diagnosed cancer and cause of death in females worldwide, and especially a very significant healthcare challenge in Latin America and Ecuador, where, as you can see in these graphs, there is like higher incidence and mortality rates in women in comparison to like in North America or like Western Europe. And in Ecuador, there have been some national efforts to like combat this issue, like with HPV vaccination programs that was established in 2019, but it hasn't been very successful. Similarly, something that was also like very interesting that I saw was that although screening services are offered in some healthcare facilities, women are not like actively invited for screening. So only a fraction of women are screened regularly, and vaccination coverage has declined a lot over the years. And so unfortunately, cervical cancer remains as like the second most commonly diagnosed cancer and cause of cancer death in women in Ecuador. And some barriers to like why these like programs are not working included like insufficient like public awareness and knowledge, safety concerns, and like difficulties in access and cultural barriers. And these barriers only become pronounced in females who live in rural areas and belong to indigenous communities in Ecuador. And Chimborazo, it has this like the largest population of rural indigenous people, and that's the population we're directly trying to serve. However, like the barriers to care in Chimborazo specifically have not been entirely focused on in the past. So our goal was to kind of combat this issue and like improve healthcare access and delivery by assessing previous initiatives and collaborating with like healthcare professionals and experts. And so the primary purpose of this project was to create like a framework for implementing cervical cancer screening, treatment, and prevention. And by assessing previous programs at FIBUSPAM and consulting with health professionals and experts also at PACH, I aim to identify and address like barriers to increase access to cervical cancer information and also healthcare services. And another key aspect of the project was the development of like an educational deliverable, which included the transcript and planning of a video that provides like an in-depth overview of cervical cancer and like prevention methods like HPV vaccination and screening and treatment options. But I'll get more into detail about like what that video includes in a little bit. But information sources. So for this project, I use data from sources like the Global Cancer Observatory and like the HPV Information Center, and also conducted interviews with like healthcare professionals from Hospital FIBUSPAM and experts from PACH. And I think these interviews provided me with a lot of valuable insight into the challenges and the barriers to cervical cancer care that are specifically faced here in Chimborazo. And this project relies on the involvement of like various stakeholders, which that includes like community health leaders and like health workers. So I worked on conducting like a stakeholder analysis to like identify their roles, their interests, and like levels of influence so that we can have like an effective collaboration throughout the implementation of this project. So geographic and community outreach strategy. Another important aspect of this project was doing like a geographic analysis and taking into consideration the challenges of reaching rural communities in Chimborazo, whether that's due to like mountainous terrain or like the climate. So I made plans for like effective logistical planning. For example, that included like ensuring portable and like lightweight equipment that would be utilized in these medical campaigns. Additionally, like I planned out a community outreach strategy of like how we can actually spread awareness and the word about such campaigns. And main stuff that I identified were like utilizing the radio, social media, and local television. But I think it was also important to emphasize the use of both Spanish and Quechua so that we can reach a wider audience and make sure to address like the cultural and like linguistic barriers that people usually face in these communities. And then project implementation phases. So this project, I plan it to be implemented in 3 phases, which is something different to kind of like what has been done before at FIBUSPAM. So the three phases would include community education engagement, screening and treatment, and then follow-up. And so the first phase would focus on like raising awareness and addressing the misconceptions about cervical cancer through like a structured educational session and just like interacting with the patient. And while talking with doctors at FIBUSPAM and like people at PACH, one aspect that they emphasized continuously was just like the lack of knowledge and awareness of um in these like people in these communities, and that's just like a very significant barrier to the acceptance of screening and treatment. So by like prioritizing education and engagement, I tried like with this project to like build trust and like ensure community members understand the importance of cervical cancer prevention and care. And so with this, it would also include like heavily utilizing the educational video. And the second phase would be like the actual screening and treatment. So like actually going out to these communities and providing free screening and treatment services. Um, Doctors also like emphasize logistical challenges and like cultural barriers that like often prevent women from accessing these services. So having and planning these mobile campaigns, we would bring healthcare directly to the communities, ensuring that these services are accessible and that those who are providing these services are also like culturally aware and sensitive. And we planned that like there would be various health services involved, including like VIA tests and like pap smear tests, and then diagnostic exams like colposcopy, biopsy, and then thermocoagulation for on-the-spot treatment. So that's all part of the plan. And then the third and last phase would be follow-up. So 2 to 3 weeks after the initial screening and treatment, follow-up visits would be conducted to provide like additional care and like to ensure that patients receive the results and necessary post-treatment support. Past campaigns often like lack this aspect of follow-up due to resource or like time constraints. And this was a very, very big important aspect. I think by including this phase, I wanted to ensure like this continuity of care and like addressing ongoing health concerns, because after you screen and treat, oftentimes in past campaigns we would never see those patients again, but you don't really know what happened after you treated, or like letting them know about their pap smear results or their biopsy results. So having this phase would also reinforce just like the importance of ongoing prevention for the patients that we would be serving. So this three-phase plan, hopefully, I think would make this project more effective. And the video transcript and target audience. So that's the main educational material that I created. So I plan and design the entire transcript for the target for the video with like various target audience within the community. And those target audiences included like women of screening age, their families, and also young girls that would be eligible for HPV vaccination. And the content was like tailored to address like specific concerns and misconceptions that were identified by the doctors at FIBUSPAM. So I'll do a quick rundown of like what the video would include. So number one would be like introduction and like understanding cervical cancer, like what it is, how it is caused by HPV. Then it would include like statistics and importance of screening and like highlighting the high incidence and mortality rate of cervical cancer in Ecuador, but then also emphasizing the importance of early detection and that this is also a very highly like preventable disease. Then it would go into screening methods, so like VIA and pap smear tests, and not only explaining what these tests are, but also it would go through what a patient should expect within the procedure. So like actual step by step, like what they would go through if they actually went through with the screening. And then the next portion would be addressing like frequently asked questions and misconceptions. So that could be about like screening process, like pain or like side effects, and that kind of questions that was brought up by the doctors. Then it would include like post-screening and treatment options. So again, like outlining the next steps after screening, which could include the use of thermocoagulation for like treating precancerous lesions, or like further diagnostic exams if that's what's necessary. So that's like colposcopy or like biopsy. And so again, like going through step by step what they would expect in each of these procedures. And then the next part would be HPV vaccination. So I think it's also important to talk about other prevention methods, especially for young girls. And so just addressing common questions about safety and like the efficacy of the vaccine. And last, and I think this is probably one of the most important parts, would be testimonials. The video would also include testimonials not only from women who have undergone screening and treating, but also from male community health leaders and spouses, encouraging others to participate, because A significant barrier that was identified is that many women here ask for their spouse's permission before seeking medical care. And so the material that is also planned should not only target women who need treatment, but also the men, because as much as it is important to inform the people who are getting the treatment, if they're not the ones making the decisions, it won't have as much of an impact. So informing both men and women for the acceptance and like success of these health services was like a very important aspect that I took into consideration. And then after the video, we have like financial projections and tech considerations. So I also did like an inventory of the material available and like discuss with professionals on like what's actually needed to implement this project and like calculate the financial projections, which include like detailed costs and like expenses for each phase and like investments that we would make for like reusable equipment. I also talked with like doctors on any new equipment that we could implement to make these programs more successful. For example, one recommendation was a new tool called Evaculpa, which is like a portable and handheld colposcope that can like be easily utilized to do diagnostic tests in rural communities. Because one barrier that was actually also identified is that some women in the communities do not really prefer the VIA method for screening, and they expect doctors to use a colposcope as part of the screening. However, as you guys probably know, like traditional colposcopes are very impractical for field use due to their weight and their size. It gets very easy for them to break in like rural communities. And so utilizing this new equipment will not only maintain that practicality in the field, but also address this concern of some women and then hopefully address those barriers to accessing care. And lastly, I conducted like a thorough risk assessment to identify potential challenges and like develop strategies to overcome those risks, whether that's like logistical planning, community engagement, financial planning, and then also consider aspects like cultural norms and barriers, financial constraints, potential resistance even from like healthcare providers. And to ensure the project sustainability, I focused on like planning the training of local staff or like creating a self-sustaining financial model. And I think overall this project has significant potential for replication in other regions in the future. So I also tried to provide recommendations on how this can be done successfully. But yeah, so positive impact and just like what's next steps. So I think hopefully this project could have a long-lasting impact on the local communities by reducing cervical cancer incidence and mortality rates through increased awareness, screening, and treatment. And so just like by addressing these specific barriers, I aim to create like sustainable and replicable model. And I think that for the next intern that comes after me or anyone else who decides to take on this project, their next steps would include first creating the educational video, because I created the transcript and like gave suggestions on like what subtitles to use or like what visuals to use. So someone actually taking that on and like creating that video would be, I think, amazing. And then securing funding and resources, and then continue to refine and actually implement the project plan. And I think it would also be extremely useful to develop like a system for monitoring and evaluating the project's impact, whether that's like data collection on screening rates, treatment outcomes, and just like also community feedback to continuously keep improving the program. And I think for long-term goals, I think expand the program to reach more communities in need would be very impactful, because there are so many communities in need in Ecuador, not only in Quito, not only in Riobamba, so there's a lot of different cities that I think we could reach. And I think part of this would also be working on collaborating with other healthcare professionals, community leaders, and also just like organizations and stakeholders. I think that just would be very crucial to the project's like long-term implementation and just success. So that is overall what I did with cervical cancer.